about a 10-year window in which the body has trouble handling blood sugar, but the person doesn't yet test positive for diabetes. That is a much better and easier time to reverse the process of diabetes. So let's talk about how it's diagnosed. So with insulin resistance, we use an 8-hour fasting insulin blood test. With cardiometabolic syndrome, we're using blood pressure, waist circumference, triglycerides, HDL, and fasting blood sugar. We use those same labs and measurements at 3 to 4 month intervals to see how you're progressing through this reversal process. How do we treat it? Well, the first thing is that we change the food end. So what we're looking for is a low glycemic index diet. So glycemic index is a scale that goes from 0 to 100. Every food is assigned somewhere on the scale. You want to eat foods that are 50 or less. Watermelon has a high glycemic index, but there we need to think about glycemic load. So for watermelon to be harmful, you would have to eat a lot of it. And probably not that many people will sit and eat, a whole watermelon at a sitting. That would be a problem. So we're looking for a glycemic index under 50. We're looking for organics. Why is that? The organics is because there's some real interesting studies that say that the people who are becoming diabetic are those with high levels of pollutants in their body. So they're called persistent organic pollutants. And they correlate with who gets diabetes and who doesn't. So you can have two people with the same weight, same amount of exercise, same family history. One becomes diabetic and one doesn't. So with organics, most of us can't afford or don't have available to us organics all the time. So you can use as a guide the Clean 15 and Dirty Dozen. So the Clean 15 are foods like avocado and asparagus, where it's less important to get as organic. And then the Dirty Dozen are things like apples and zucchini, where it's more important to eat organic. Then there's supplement. So people with diabetes, I would say all should be on lipoic acid. Then there's some other nutrients that are important. There's chromium, there's L-carnosine, and some others. There's herbs, there's devil's club bark, milk thistle seeds, prickly pear fruit. So here we work with some very good nutraceutical companies that put together combination products. You try a product out, you make some dietary changes. The idea is to keep you safe and to progress towards having a very good way that your body chemistry handles metabolism. Okay, good luck.